Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Ana Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome to Physician Heal Thyself, the podcast. I want to remind you that this podcast is dedicated to bringing education to many sorts of different people, right? Not just people who are patients. And while we talk about, health, mental health, physical health, emotional health, there's also a lot of educating that needs to happen just about the medical system, right? And so this episode, I want to dedicate to exploring a question that often arises in clinics, in hospitals, and patient portals. And this is something that I'm seeing, starting to see a pattern in my practice. Well, it's not an issue, a big issue. I know that some of the bigger clinics and hospitals can sometimes have these issues. So the question that we're going to discuss, the topic we're going to discuss today is, why can't doctors simply give patients their lab results without discussing them with you? And what are the legal responsibilities that a physician, right, has in reviewing and communicating those results with you? So join me on this conversation, because this topic, it sits at the intersection of law, ethics, patient safety, and trust. And it's all centered to the practice of medicine. So let's walk through it together, okay? The first segment we're going to talk about is the physician's legal duty of care. And so sometimes in medicine, either patients make assumptions about the doctors, the practice in medicine in general, right? It's normal. You don't know all the insights. But sometimes also as physicians, we can tend to overlook because we're so in the practice of the work that we do, that we forget that not everyone understands the legal ramifications of the process of medicine. So I want to talk about what are some of those legal duties of care. When a doctor orders laboratory tests, any imaging, the doctor has entered a legal duty at that point. So a legal duty has been created the moment he orders a lab order test. Now, the patient goes and draws the blood test, right? And then they get these results. And this duty is going to include, this is the physician's responsibility. And I'm not speaking against one side or another. It's just pure education on what that process falls on the patient. Because just as much as there's responsibility on the physician side, there's also responsibility on the patient side. So the physician's duties, part of the responsibility when they issue a lab order, is to receive and review the results with you, interpret the results accurately, communicate the meaning of those results to the patient, provide any appropriate follow-up and appropriate treatment, and then also provide any necessary referral, additional testing, or additional imaging based on those results, right? Sometimes those results come in and it doesn't give us a full picture. So we need to, refer to either a specialist, an endocrinologist, a cardiologist, or do additional blood work or imaging to give us a better picture of what's going on. We're gathering information as physicians. So legally ordering a test it's not complete until these steps occur. And these things happen during a consultation, not in a text message, not in an email, and not in a random phone call. And I think this is where patients, because of the convenience of, technology and just modern, just the conveniences of technology that are offered now, a lot of people think that they can text the clinic, they can send an email or just a quick phone call and to review that. Now, many doctors' clinics now offer telemedicine, and that is appropriate to set a consultation time, whether it's virtual, via a virtual platform or a telephone call. But it is a specific time that the doctor is setting to discuss those results with you, to share them and review them with you. And it also allows the doctor to make time in their busy day to chart, to notate the conversation, what you report, and what was shared in that conversation. So that could be an appropriate manner, but just a random 1-minute phone call, you want to know the results. Oftentimes, that's not the appropriate legal manner that a physician would take care of discussing those findings. Now, failing to review or communicate results can be considered negligence. It could be failure of follow-up care, and it could be a breach of standard of care. So this would fall as a legal matter on the physician's part if this doesn't happen, because untreated abnormal tests can lead to serious harm. And so courts view this responsibility very serious. So when you've done tests and your doctor's reaching out to you and you're putting it off, you're actually putting your physician in a compromised position. Oh, but don't you worry. Doctors notate everything. The clinics will notate the attempts that the number of attempts that they've tried to contact the patient, the day, the time, the way, the modality that they were trying to access the patient, whether it was a phone call, if they left a message, if they sent a letter, whatever it is. Because if the physician does not complete the work of reviewing the findings on those lab results, it can fall on them. So they want to make sure that legally they're covered, and they'll document that even if you, the patient, are not willing to go in or have a consultation to review those tests. The second segment I want to talk about is why simply releasing results is not enough. And there's 3 main points in this that I want to point out, okay? So many times, many patients now receive automatic, lab reports through an online portal. While transparency is valuable, I know it's nice to be able to see your results right away. The data alone is not medical care. And let's be honest, while you can plug these into online and try to understand what they are, you still don't have all the necessary education and experience to interpret those labs. So the first point I want to discuss is lab values require clinical interpretation. The number on the screen is not going to explain whether the result is truly an abnormal finding. Sometimes a value could be slightly off, and it's not that big of a deal because chances are if you did the blood test tomorrow, it's back to normal. How significant the abnormality is. And then if you're working with a naturopathic doctor or a functional doctor, you won't know what optimal ranges are. So we look at what our optimal ranges. We also look for patterns of the totality of the lab result findings. And so you may not understand the pattern and how, the body is working in all of this information that we've tested. You won't know what condition it may indicate. Yeah, you might plug in these numbers online to some AI platform and try to diagnose it yourself. But how do you know for sure? How are you 100% confident of what you are looking at is actually indicating that condition? And then also, you won't know what are the necessary actions, if any, are needed, right, to remediate those issues. Without interpretation, patients may panic over harmless variations, which is oftentimes what I see. They can ignore dangerous abnormalities because on the flip side, some people are super positively, they're on the positive mindset. They're in denial sometimes, and they might find that you do have diabetes, but you're in denial that you have diabetes. So you might just ignore that finding and not allow the doctor, right, the physician, to discuss this with you. And then you might misunderstand what are those next steps based on those lab findings. So legally and ethically, physicians must ensure that patients receive meaningful understanding information, right? That they understand what this is, and it's not just raw data. We need to know you need to understand what's going on and what are your next steps. Which is why physicians do not like to provide lab results before consulting. Please listen. There's a reason why. It's not that doctors are trying to control your information, that they don't want to give you access to. We know that people are now turning to AI to interpret findings, and this is very, very dangerous and a serious legal violation for physicians to not discuss findings. So it's not uncommon that a physician may release those results before consulting, and then the patient is never seen again. They never come back in. The doctor never had the opportunity to review those findings and to discuss the next steps of treatment. And this can really compromise both the patients, right? Ultimately, it's the patient's health that's at risk, but also legally the physician, if anything were ever to be questioned on their end. So please understand that when a physician is not willing to release those lab findings prior to consulting, it's for your own good, and there's legal reasons as well. The second point on this segment is that preventing harm from misinterpretation. Like I said, I know there's a lot of online platforms that allow you to plug these things in, but this is not a person. And we're going to discuss more on this later on. But if a patient misunderstands a result and it delays treatment, takes the wrong medication, doesn't take the medication, or assumes everything is normal and they're just going to be in denial that they truly have a medical condition, that outcome could be very severe for the patient. And because physicians initiated the testing, the law generally holds them responsible for closing that loop of care. And this often is called the duty to follow up and inform. And I'll tell you, as a physician, it leaves me very, very unsettled when someone asks me for lab results and if I provide them to them, the results, and they don't come back, they don't follow through. I never get the opportunity to review what's there, to review the different options, the different alternatives they have, conventional and natural, and sometimes just even to give them hope, like, hey, this condition is not devastating. They just don't come back, and sometimes the patient will interfere in their own treatment, right, in their own care. The third point in this segment I want to discuss is abnormal results that require action. So certain findings demand an urgent phone call. So it's not unusual that I've had lab results and a female is super iron deficient, but also red blood cells are dangerously low. So I'm not going to wait for this patient to come into my office and tell them what the treatment is. I'm going to call them and tell them, I got your results in. Your red blood cell levels are dangerously low. Iron is really low. You need to go into the hospital for a blood transfusion immediately. So I'm not going to wait for them to come into the office. I'm going to tell them what they need to go, or if other lab findings are dangerous and they need to be seen in the in the emergency room. It has to be an emergency room. Urgent cares won't offer critical, care to patients. And so we indicate that to the patient to go. So urgent phone calls may be necessary. And it's very unsettling as a physician when we contact the patient and they're not calling us back, they're not responding, or they don't want to go in for that urgent care. There might be a need for additional testing as well, and we would only know that once we review that and discuss that with patients. There might be a need to add medication, change medication, stop certain medications. There might be an emergency evaluation, like I said, with this other case I mentioned, where they have to be seen at the hospital for a blood transfusion. And maybe there's a referral to other medical professionals at this point that they need to be seen. That's what these consultations are for, is to help them, guide them in that direction. Now, if a doctor merely refuses the results electronically without ensuring the patient understands, right, the abnormality may go untreated and harm may occur. And so legal liability may follow. And it's not always the physician's fault. It could be the patient who was just in denial and refused to continue care at that time. And so this communication is not optional. It is a required part of safe practice for you, the patient, and for the physician who's practicing medicine. Now, in this next segment, I want to talk about the standard of care and medical negligence. In medical law, yes, there's a whole category of medical law Physicians are judged by the standard of care, meaning what a reasonable, careful physician would do in the same situation. So the lab results, for lab results, this standard typically includes timely review, documentation of interpretation, direct or reliable communication with the patient, and a clear follow-up planning for treatment, right? So failure in any of these areas can form the basis of a malpractice claim, particularly in injury results. And that's usually when it's the problem. There's an injury, or this patient had done those labs 5 years ago, never went back to the doctor because they didn't want to. They got the results. They didn't want to go back to the doctor to follow through. And they just ignored the fact that there were medical conditions on those results. This happens. This is why I'm discussing this. And then the family doesn't know that this is going on. And then they come to find out this person saw a doctor, these findings were there, but they were never discussed with the doctor. And sometimes it is, like I said, the patient's fault. Now, if your doctor's clinic says, we'll call you when labs are in, and a month and 2 months, 3 months pass, I mean, you shouldn't wait that long. But if time passes and you haven't gotten a call them. Say, hey, are my lab results in? I need to schedule a follow-up appointment to review them. Then do that. Because unfortunately, conventional practices, they are super busy. They see a lot of patients. And, oftentimes their patient consultations are under 5 minutes. So they have a lot of patients. Sometimes they have a lot of employee turnaround right now. So it still is our responsibility in the patient seat to contact the office if we haven't been contacted for that. It's not that they don't want to review them with you. They might just have overlooked your case, right? Unfortunately, that does happen in very busy clinics. So some of the common legal cases would involve examples such as missed cancer diagnosis due to unreviewed labs. This happened a lot during COVID because of the lockdowns and doctors not being in the offices. Critical values that are not communicated to the patient, abnormal findings without proper follow-up, right? Follow-through in care. And these cases highlight why physicians must treat lab reviews as a serious legal obligation. It's not an administrative task. Listen, a lab review is a legal obligation. And if the patient interferes with that, the doctors are at risk. And most doctors will document every attempt at trying to get patients to come in. I know on the patient side, many of you might not think that's not something that happens common and frequent. You would be surprised how many people, I've seen people even pay for specialty tests, $300, $400, $500 that they're paying for these tests. And then trying to get a hold of them, it's like they've gone missing, and it is still their obligation to ensure that they're returning back to review those findings, And I know sometimes people deal with mental health issues. They might be depressed. They might have anxiety around that. And so regardless, it's still important to sit with the doctor, right, and discuss those findings. This next segment I want to talk about is the ethical responsibility beyond the law. Even part of the legal risk, the deeper ethical principles that guide physicians are the beneficence of acting in the patient's best interests. Like, doctors really do go to school to help people. They might be overwhelmed, right, and busy with the years and the amount of work they have, but they still have their interest is to help the patient and keep them safe and alive. And so patients deserve, guidance, not confusion. We have the do no harm, right? First, do no harm to patient as one of the top principles of medicine. So silence or incomplete communication can cause preventable injury by just following through and making sure the doctor is reviewing your labs and it's not some AI software. So respect for persons, true respect means ensuring that patients understand their health, not merely handling just the information. The information is just a part of the process. It's not the entire process, right? So reviewing labs together is both a legal safeguard and a moral commitment to care. So why the conversation matters in healing is, discussing these results with a physician. It's going to allow a number of things. One is to place the numbers in a real life context, and what that means is sometimes I see a value, say it's a liver enzyme, that it's slightly, just a little bit off, and it's always off, no matter how many times, how many years, it's just a little bit off. You could refer to a hematologist, and most of the time they come back as just normal for this person, for that value to be just a slightly bit off. So we look at it in real life context, and we realize it's not a serious issue, right? So we don't have to do anything to medicate the person for that. We can address fears and questions when we sit down with our patients. I can speak for myself. I can't speak for every doctor out there, but my efforts, my attempts is to address questions and the fears and concerns they have, any anxieties they have, to address it with being cool, calm, and collective, right? And to educate the person and provide hope in the process of delivering that information, even when it's critical information. If it's a cancer diagnosis, I have a certain way that I present that information to them to still instill hope in them that they can recover from this, and how to mentally and emotionally respond to that. So physicians, a smart physician and a physician who has emotional intelligence, is able to communicate effectively with the patient, is going to be able to gauge themselves and accommodate to that patient. I know this is not always standard in conventional medicine, but I have interacted with several medical doctors in hospitals and in specialties that I do see that they are communicating effectively, and they are emotionally intelligent to gauge to the person's response to the medical findings. This is an opportunity where we get to explain the treatment options. In naturopathic medicine, we have many options. And oftentimes, most doctors, when we receive lab results or imaging, anything that we're examining, we take time to review them. I do. I review them before the visit, and then I start coming up with a list of treatment options to review, discuss with the patient, and give them some, hope of the direction that we can go in. It can strengthen the relationship, right? The trust between the doctor and the patient when we sit down and we discuss these things. And I'll tell you, in my clinic, I don't sit I don't sit right directly in front of my patients. My office, if you're my patient, my desk is here, and my patient sits right to my right, and I face them, and I'll type on my computer, and I am looking at them. My body is directed to them, and I'll turn to my laptop when necessary, so that when a patient starts to share something that is vulnerable, it's personal, it's deep, and they need my attention, I directly turn my body, my whole chair, I turn to them and face them head on. If you're in medicine, if you're a doctor, any clinician, any time you're interacting with people, that's what we need to do, is we need to face them and open up and listen to them. It makes them feel safe. It makes them feel comfortable. And more importantly, it makes them feel heard. And so this strengthens that trust between the patient and the doctor, and vice versa. So this time also allows for support that's shared decision-making. I always tell my patients, I provide you the treatment options, and between you and I, we decide where we're going to take it. I'm going to provide you my recommendations, and you get to decide, and together as a team, we will, move forward in that decision-making process. The decision-making process in all treatment, in all care, it's between the patient and the physician. Nobody else, not your government, not other family members. If you want to include them in that process, you can, but it's not your friends, it's not your neighbors, it's not what social media is saying, it's not what AI is saying. It's between you and the doctor. And that is a beautiful, beautiful patient-doctor relationship. And if you've never experienced that, find a doctor that you can experience that with. That's the kind of experience that I've had with my naturopathic doctors in the past, right? So this is going to transform that lab report experience from just cold data, right? Most doctors don't even show you the labs. They might say, oh, this value is off. Here's a prescription, and you're off. Unfortunately, that's conventional medicine. I apologize for that. But it's going to turn just presenting cold data into a compassionate medical care. And that's what using these AI platforms to interpret your lab findings or provide medical care, you're not going to get that there. You lose that. And so I am going to be doing an episode all on that the next week. So you want to stay tuned for that. This next segment, as we get ready to close up here, the patient's role in this partnership. Let's talk about that. Because while physicians hold legal responsibility, safe care is strongest when patients also do their part. And so this is for you, the patient, the person who is working with the doctor. It's your responsibility to review messages and calls promptly, right? Get in contact with your doctor's office. Make those phone calls. If they're not calling you, you call them. Ask questions when things are unclear. I always educate my patients to understand that when you go see any other doctor, you can ask questions to clarify. And if sometimes the doctor, they're out of time, they got to go see the next patient, tell them, I would like to set another appointment to come in and discuss these questions I have, or whether it's a phone call. And they will schedule another appointment for you to take the time to do that, right? Attend your follow-up appointments, right? Those are important. And also that you follow the treatment plan. Because I always tell patients, if we create this amazing treatment plan of options, but you don't implement those changes at home, you don't take the supplements, the herbs, the medicine, whatever it is that we're recommending you do, it's kind of pointless. So then it's easy to point the finger at your doctor and say, well, that didn't work and that didn't help, when really it's you that didn't do your part. And I get it, that sometimes implementing change could be a challenge. Totally understand. Start where you're at and just do it. Attempt it. Do it. Even if it's not perfect. As you go through the process, you will perfect it every time. You will learn and grow, but you got to take the steps to make the changes. Healing works best as a shared commitment, not a one-sided task. And so what we often see is either the doctor's really, excited to help you and the patient's not. The patient wants you to just resolve it. Or the patient's really excited to want to improve their health and the doctor's not really involved. So you need to find a relationship that really aligns with you, that aligns with what you're looking for. So in closing, I just want to, it may sometimes feel inconvenient to wait for a doctor's explanation of lab results. I get it. We live in a culture in this country where we want it now, right? We did the blood draw this morning. We want the results today. I've had people, they did the blood draw a day or two ago. Are the results? And I'm like, no, it could take 7 to 14 days, sometimes 3 weeks on some of them. So I reassure them. I get alerts when they come in. We will contact you, but you're welcome to continue to check in. I don't mind being checked on, if people want to check in to see if they're in. But behind the process lies something that's essential. Behind that process, there's protection, there's a responsibility, there's care, and respect for the value of human life. Those test results are important. They mean something, and you should give your doctor the opportunity to review them with you. Medicine is not fulfilled when a test is ordered, or even when a result appears. That's just the beginning process. That's just a part of the puzzle of the bigger picture. It's fulfilled when understanding is shared and the patient is never left alone in that process. With information, they cannot safely interpret, right? We can't just leave the patient to here you go, and you're on your way. So sometimes patients don't understand that legal part of us, that we can't just release something without discussing it with you. And when we are in a doctor-patient relationship, I know who I can release those results prior to the visit, because first of all, I take a lot of time to educate my patients on those tests. So if I do hormone tests, I've explained that pathway a good amount of times over the years. They know what they're looking at. They look at the pregnenolone values. They know the optimal ranges that they're looking for. They know what testosterone levels are healthy. They understand that process. So I feel comfortable to say, if they ask me, can you send me my results? I'm comfortable to send it to them, because I know that patient is still going to follow through on their visit, which we're going to discuss, because even though you know that information, you understand the lab findings, sometimes what I find when I sit with the patient, I start asking them questions, because I'm asking, how are you feeling on these supplements, on these medications, on those hormones? And we get a full history of energy and sleep and so forth. And so then they start to share things that they didn't even were aware it was an issue, or they had improvements. Or maybe we need to modify the medication based on what they're telling me, how they're presenting. We can decide, it sounds like you might be on too much estrogen, too much testosterone. Let's reduce it back down so that you're not feeling agitated, irritable, or with estrogen, women can have, breast tenderness. So that's a sign that you're on too much, right? So we need to taper that down, reduce it. And that's what these conversations are meant for. So when you're in relationship with the patient, as a doctor, I know who I feel safe to release that information to, because we're gonna review this together ultimately, right? But when you're a first-time patient, we don't know. Is she gonna come back? Is he gonna come back? Maybe, maybe not. So, hey, I want to thank you guys for joining me on this episode of Physician Heal Thyself. I know that this discussion, I hope this discussion brought clarity, consideration of what your doctor might be feeling when you ask, can you send me my lab results, and why they might be hesitant. It's not personal. They're not trying to control you. No, they're not just trying to bill your insurance for a visit. They legally need to review those results with you. And even if you're not going through insurance and you're paying a doctor cash, they're still legally bound by their medical association, by the state law, to review those results with you, because they have entered a legal contract the moment they issued that lab order. The same with the prescription. They issue a prescription, it is a legal order. And I want you to look at it that way. Maybe have a little compassion when your doctor refuses and says no to you. So consider sharing this with someone who maybe has wondered why medical communication matters so deeply. Until next time, seek understanding, value partnership with your doctor, and remember that true medicine is not just knowing the results, but walking with someone through what it actually means and what it matters to you. So until next time, I want you to join me in the next conversation, because I'm going to talk about, are you turning to AI for medical advice, and the things you need to understand before you do so. So until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.